I have a personal connection to non-communicable diseases, and that is because my father died in 2001, and he died of prostate cancer. My mother died in 2016, and she died of complications of high blood pressure and diabetes. My stepmother died of breast cancer. I lost a friend and somebody who worked for me last year. We celebrated 1 year since she passed. I'm sure most of you know Mawena Dumo. She died of breast cancer. And currently, I have a staff in my office whose son is in his 30s and is on dialysis, is suffering kidney failure, sold his motorbike, sold his TV. And much as I also tried to support, the cost was becoming unbearable. Eventually, he died. I've pledged half a year, 6 months of my salary to Mahama Cares. I'm not yet being paid. They say Accountant General is still doing something. But whenever Accountant General finishes, 6 months of whatever I'm entitled to will go into Mahama Cares.
Them Company Limited at Abosokan in the same building with Ghana Commercial Bank GCB on the Glyco Road. Call us on 0244-666857 or 0244-798445.
Exact battery now. Ya trotro da bebe ya jiatu.
Me a diabetic patient. Emri bebre etwemu no. Ye hunu se eye panyefo yare. Ana ne omu wosika omu di srochi e na omu nya sa yare no.
I mean, the remarks by our sister here, I mean, very touching. I can empathize with what she's going through because she's just one of many of our citizens and countrymen and women who are going through what she just talked about. And the perception was that if you were rich, it was a disease for the rich. Hypertension, cardiovascular diseases, diabetes were diseases of the rich. But increasingly, we see that it's inflicting more the persons who are much poorer and can least afford to be able to manage those diseases. And that's why the Ghana Medical Trust Fund has come at the right time. I have a personal connection to non-communicable diseases, and that is because my father died in 2001, and he died of prostate cancer. My mother died in 2016, and she died of complications of high blood pressure and diabetes. My stepmother died of breast cancer. I lost a friend and somebody who worked for me last year. We celebrated 1 year since she passed. I'm sure most of you know Naana Opoku-Agyemang. She died of breast cancer. And currently, I have a staff in my office whose son is in his 30s and is on dialysis, is suffering kidney failure. And so these are not things that are far away from us. These are things that are close to us. These are loved ones that we're talking about. And so like Prof said, we must not see them as statistics. We must see them as real lives that we need to touch and help. But there's the even sadder story of one of my confidants and strong supporters when I started this whole political journey. He was an assemblyman, and he was an executive of our party in Bole Bamboy, where I started my political career as a member of parliament. Very close to me, went everywhere with me. Anytime I went back to the constituency, he was in charge of the southern zone, and so anywhere I went, he went with me. And a few years back, he started to have a problem with his kidneys. And so at the time, there was no dialysis north of Kumasi. And so if you had kidney failure anywhere above Kumasi, you had to travel to Kumasi to do dialysis. And so he used to travel from Bole Bamboy like once every week to do dialysis, go back, and the cost was unbearable. I tried to help as much as I could. Eventually, he needed more, a dialysis treatment, and so he couldn't be going and coming. So he had to move his whole family to stay in Kumasi, rent accommodation in Kumasi, so that he could be close to Comfort Noche, where he was undertaking the dialysis. Sold his motorbike, sold his TV. And much as I also tried to support, the cost was becoming unbearable. Eventually, he died. And he died leaving poverty behind because he sold all his assets to be able to look after himself. And so we had to take care to support some of the children to be able to finish school and all that. These are real stories. And that is why what we're doing today is important, because it will touch a lot of lives and help a lot of our fellow citizens. But let me say that this program must be linked and will be linked to our primary health care project, which we are yet to launch. Because under the primary health care, we envisage that there will be volunteers and designated community pharmacies where our citizens, wherever they live, or the CHIPS compounds, will be required to go and take their blood pressure, check their sugar, because like was said by the UNICEF director, these diseases are preventable. And even if they have an onset, if you detect it early, you can have a favorable outcome if it's detected early. And so the primary health care would have community volunteers who will go from house to house occasionally, maybe every 3 months, every 6 months, and just take people's blood pressure, check their sugar level and all that. We will have a program where women, are able to detect lumps earlier to be able to get treatment in case they are developing breast cancer, and so many of these other things. So I think there should be a linkage between Mahama Care and the primary health care program when we launch it. But more especially, a lot of these diseases are caused by ignorance in terms of our lifestyles and all that. And so we must also, as part of the Ghana Medical Trust Fund program, launch a very strong awareness campaign so that people will know what the trigger factors for these non-communicable diseases are. I understand that some of them are genetic because you can inherit it from your parents and your genes, but a far greater number are lifestyle diseases. They are acquired, they are not genetic. And so if people just know, what their disposition is and they are able to make changes in their lifestyle, I'm sure that we should be able to bring down, the level of disease burden that we currently are seeing. I want to thank our brother from CalBank for the very good testament he made about the need for support by corporate Ghana in this particular exercise. And I want to encourage corporate Ghana, businesses, the mines, the banks, and all the other companies that this Ghana Medical Trust Fund program is coming to help are your clients who save their money in your banks. They are your clients who do business with you. And indeed, they are not only your clients, they are even your own staff. Some of your staff have died, from breast cancers and diabetes and all that. And so, as part of your CSR, if you give anything, you are giving it not just to help people, but to help your own clients and your own, your customers and your own staff. And so, I'd like to encourage all corporate Ghana, that is private sector and state sector, to annually devote a portion of their community social responsibility to Ghana Medical Trust Fund, because it's going to do a lot of good to our country. I want to assure Prof. Adanu that while he was speaking, the many suggestions he was throwing out, I turned quietly to the Minister of Health and asked, "Are you taking notes?" And he quickly took his paper and started writing. So, Prof, you can be sure that note has been taken of the suggestion you made, and we want to thank you for that. I want to thank Professor Aite, who's been my long-standing friend and mentor, for the contribution he made. Prof. Aite is a retired specialist, emeritus professor, and very well known in medical circles. And so when he gave the envelope, for a retired pensioned, medical professional, I was curious to see how much he had given. And so after I took the check, I gave it to the health minister. But after a while, I collected the envelope back. And I peeked at it. And he won't want me to mention it, but I want to say that I was surprised at how much he's giving. Society, a doctor on pension has given $1,000 to Ghana Medical Trust. And so that should encourage all of us and encourage, the corporate institutions to do even much better. But on that note, I also, as the initiator of this laudable program, would also have to give something. And so I've pledged half a year, 6 months of my salary to Mahama Cares. I'm not yet being paid. They say Accountant General is still doing something. But whenever Accountant General finishes, 6 months of whatever I'm entitled to will go into Mahama Cares. For the official launch of the Ghana Medical Trust Fund, Mahama Cares, as it's called, a landmark initiative introduced by my government to decisively confront the growing burden of chronic non-communicable diseases, for short NCDs. The fight against NCDs is intrinsically linked to our broader national development agenda, particularly the Sustainable Development Goals, and most notably SDG 3, which enjoins us to ensure healthy lives and promote well-being for all at all ages. Specifically under SDG 3, Target 3.4, commits the global community to reduce premature mortality from NCDs by 1/3 by 2030 through prevention, treatment, and promotion of mental health and well-being. Across the globe, non-communicable diseases, including cardiovascular diseases, cancers, chronic respiratory conditions, diabetes, and mental health disorders, remain the leading cause of mortality, accounting for over 43 million deaths annually worldwide. Worryingly, the burden is disproportionately borne by low and middle income countries such as ours, posing not only a public health crisis, but also a profound social and economic threat. Non-communicable diseases exacerbate poverty, they widen social inequality, and undermine economic development. Vulnerable populations, that is those with lower education, limited access to healthcare, and lower income levels, are currently most at risk. Addressing the NCD menace is therefore not merely a health imperative, it is essential for advancing economic growth, promoting social justice, and securing environmental sustainability. In Ghana, the picture is equally alarming. Available data indicates that NCDs amount for over 40% of all age category mortalities, and they consistently rank among the top 10 causes of death nationwide. Even more disturbing is the steep rise in hospitalized cancer cases, which jumped from 3,487 patients in 2012 to 16,105 in 2016. Alarmingly, adults aged from 18 to 45, the prime of our nation's workforce, account for more than half of these cases, 16,000 cases. This troubling trend is driven by a convergence of factors. One, shifting lifestyles characterized by things like tobacco use, alcohol abuse, unhealthy diets, and sedentary behavior, and also increased environmental factors. The cost of treatment, ladies and gentlemen, is not just disturbing, it can be devastating for low-income families. Estimates from our teaching hospitals reveal that the average annual cost of non-communicable disease treatment per patient averagely stands at approximately 53,000 Ghana cedis annually, and that's equivalent to about $3,300 US. Managing chronic conditions imposes crushing financial burdens on families, often pushing them below the poverty line and deepening their vulnerability. It is estimated that individuals diagnosed with chronic diseases face a 75% likelihood of falling into poverty within 5 years, regardless of their original economic standing. And so it even ruins rich people. I mean, you spend all your money trying to find a cure. Those battling kidney and cardiovascular diseases are reported to spend between 70% and 95% of their non-food expenditure on healthcare alone. Older adults living with chronic conditions spend 5 times more on healthcare than their healthier counterparts. Despite the important strides made through the National Health Insurance Scheme, it remains inadequate in fully covering NCD-related services and medications. In 2018, around 48% of all NHIS claims were related to non-communicable diseases. Yet essential services remain outside the NHIS coverage, leaving families dangerously exposed to out-of-pocket payments. It is against this background that shortly after my election as President, I directed the Honorable Minister for Health to initiate the establishment of the Ghana Medical Trust Fund, a commitment captured faithfully in the 2024 People's Manifesto of the National Democratic Congress. Following extensive consultations with inputs from over 3,300 stakeholders, the National Task Force I formed, ably chaired by Reverend Emeritus Prof. Aite, submitted its final report on April 10th this year. I'm pleased to inform you that the accompanying draft bill, as the Minister said, is ready and will be presented to Parliament when it resumes at the end of next month. Ladies and gentlemen, today we're launching more than just an initiative. We're launching hope. Hope for thousands of Ghanaians living with chronic diseases. Hope for families battling the overwhelming costs of care. Hope for a future where the quality of life is not determined by one's ability to pay for essential treatment necessary. The Ghana Medical Trust Fund will support specialist-level treatment for a range of chronic diseases, including cancers, diabetes, cardiovascular diseases, chronic kidney failure, stroke, and other complications. It will also progressively expand to cover convalescent care, palliative services, and home-based support. Support from the fund will be based on formal applications, carefully vetted, and will focus on costs not currently covered under the NHIS. The fund will operate as an independent statutory trust, governed by a board of trustees and supported by a dedicated administrative secretariat, third-party administrators, and patient navigators to ensure transparency, efficiency, and a patient-centered service ethic. Initial projections suggest the fund will require approximately 3 billion Ghana cedis annually over the first 3 years. And as was said, the main source of finance is going to come from the NHIL, the uncapped portion of the NHIL. It will also include direct budgetary support from government, voluntary contributions from corporate institutions and individuals, grants, donations, and will also be able to invest in order to raise income, investment income. Strategic procurement measures such as access pricing and framework contracting will ensure that essential medicines and diagnosis are acquired sustainably. And so I spoke to the minister and asked if we couldn't encourage our local pharmaceutical industries to increase the availability of generic drugs, which are much cheaper than the imported drugs. I know because I paid for my mother's diabetes drugs, and I know the difference between the imported drugs and the difference in cost. And so if we can encourage our pharmaceutical industry to produce generic versions of those drugs, it will bring the costs much lower. I wish to commend the exceptional leadership of the National Technical Task Force, chaired by Reverend Emeritus Prof. Aite, and to extend my heartfelt gratitude to all the professional associations, religious leaders, our development partners, and citizens who contributed their expertise and passion to bring this initiative to life. Your dedication has translated a manifesto promise into a tangible, life-changing reality. On that inspiring note, distinguished ladies and gentlemen, I'm proud to officially declare, is there going to be a fanfare? Let me know. The last time when I was just declaring something launched, then I almost ran away from the stage. Okay, there's no fanfare. All right. On that inspiring note, distinguished ladies and gentlemen, I'm proud to officially declare the Ghana Medical Trust Fund, into brackets Mahama Cares, duly launched. May God richly bless all of us, and may God continue to bless our homeland, Ghana. Thank you very much.
President Mahama, any nature for Nina, any penny for Nina Muaha, Midamasi, Michiamu. Pacho, Anopa, so I am energy, and the Mahu who said, Miss Mijinaha. Me a diabetic patient. Emre bebre atwam no. Ya hu no se eye panyefo yare. Anani omu wo sika a omu di srochi e na omu nya sa yare no. But me nim say ade ya yare a ebeti maba nkola mu nsusu. Menya no a check Accra. Ba me protect me hu kakra say me so metina se a check Accra. Yare a yare boni pa. Ekum ema we kura enwu. But nyame adom igusu metina se. Nti dia me kan say sesia no ebia ba me ban nsusu. A me gusu a me solve but enya yare a ebekọ ba ye be take care of enti dia me di ba ne se Yakopon emboye na entimi esum but ade kakra me kan se ye dro no eya ne boarding me a me gina ha no me ye single parent e won kwala 3 mu me ntimi hwe fie na adro nyakasa mato na mato amakwala no so eye di mami at times de ebe di kura nyame na ebe mu nti me adis reading say ebe se o ma pani enya ho bua maye ma adro no na yetimi nya do na yemfa keke yare we afi yeso do say enko bat ye be preventing ma dia oni bi no ono so benya adro ni bi e dia preventing ho edanasi se Mahama kes na odi bae no edanasi bebre se nyame nhira so na adwempa ayamaye se ofa bi ewo mu maye no embremu medamwasi.
UGMC pledges 100,000 Ghana cedis. Your Excellency, the President of the Republic of Ghana, Honorable Ministers of State, Members of Parliament, Directors of the Ministry of Health, Management of UGMC, my own teacher and mentor, Reverend Professor Ayite, distinguished guests, ladies and gentlemen, it is both an honor and a privilege to stand before you today to deliver the vote of thanks on this historic occasion of the official launch of the Ghana Medical Trust Fund, Mahama Cares. First and foremost, on behalf of the Ministry of Health, our health professionals, and indeed all Ghanaians, I wish to express our profound gratitude to His Excellency the President for his visionary leadership and unwavering commitment to strengthening Ghana's healthcare system. Your Excellency, your presence here today to launch the Ghana Medical Trust Fund is a testament to your dedication to the health and well-being of every Ghanaian. We also extend our deepest appreciation to members of the Ghana Medical Trust Fund Task Force, led by Reverend Professor Ayite, our honorable ministers, our partners, and every stakeholder who has worked tirelessly to bring this initiative to fruition. We say thank you. Your collaboration and sacrifice have laid the foundation for a sustainable healthcare financing model that will benefit generations to come. To our medical professionals, doctors, nurses, laboratory, allied, and all frontline workers, this fund is a recognition of your service, your challenges, and your value. May it bring improved support, facilities, and motivation as we continue to save lives.
Mahama, Honorable Minister, heads of agencies and directors, members of parliament, distinguished guests, I'm standing on existing protocols. On behalf of the health development partners, allow me to congratulate the presidency, the government, and the Ministry of Health on the launch of the Ghana Medical Trust Fund initiative, a visionary step towards equitable healthcare and sustainable financing for the fight against non-communicable diseases. This initiative is in line with the vision of most health development partners who aim to ensure Ghanaians have access to quality healthcare services, including for NCDs. As you know, NCDs are a major public health challenge that undermines social and economic development and can increase inequities within populations. Today, as mentioned by the Honorable Minister, NCDs are the leading cause of deaths worldwide. Low and middle income countries are also affected. In Ghana, the share of NCDs in the disease burden is increasing, and this is mainly due to an aging population, rapid urbanization, and changing lifestyles. Most premature deaths from NCDs are largely preventable. Through the development of multi-sectoral public policies beyond the health sector to prevent the exposure to key risk factors such as tobacco and alcohol abuse, and healthy diets and physical inactivity. Furthermore, there's a lot of evidence that support the implementation of cost-effective preventive and curative intervention in health services. Strong leadership and urgent action are required to achieve this, and we commend the government and the Ministry of Health for their leadership. However, as always, sustainable financing remains a major challenge and requires innovative thinking, and we commend the uncapping of the NHIL for this purpose. The remarks by the Honorable Minister unveil important features about this important initiative, but we look forward to learning more. Health development partners stand ready to provide the necessary support to the Ministry of Health and its agencies to help save lives, improve the health of present and future generations, and ensure that the human, social, and financial burden of NCDs does not undermine the development progress made in Ghana in recent years. Thank you and congratulations once again for this transformative initiative.
PRIZM Multimedia. When you go so share, now me say akwenya no ho de ma say wo be subscribe ye the video to ma where the first person I will sabet me aso ye video mu na wo so so a wo your man ba pa no wetumi ehunu ne ekoso e wo man mu like adintre bi so ho na opese wuja fato comment section ni mu edi ba ko pe na fa frame make meje wo so me si ha da mu nyina mwase mamomoni tia ye je me enyado.